Hello and welcome to this edition of the Wise Medical Minute. Today I'm going to answer a series of questions that have come up recently about the various technologies used in liposuction. No conversation about liposuction in an office-based setting would be complete without describing the concept of tumescent anesthesia. All of the technologies we're going to talk about today are performed using tumescent anesthesia. And that simply means the lidocaine, which is the numbing agent, is diluted and injected through tiny little incisions directly into the fat, which makes it possible to remove the fat with relatively little discomfort. Now, I'll spend more time talking about the tumescent anesthesia in a future broadcast. But using tumescent anesthesia, along with oral or IV or sometimes intramuscular sedation, we don't need general anesthesia. Liposuction is very technically feasible without the risks of general anesthesia. Now, the technologies we're going to talk about all make the results sufficiently improved that with all of the new methods and techniques as well as technologies, you can spare people some of the downtime associated with more reconstructive type procedures like an abdominoplasty or tummy tuck. But anyway, the first one I'll talk about is VASER. VASER is an acronym, but VASER technology involves use of ultrasound, and the sound waves are intended to emulsify fat, and the probe that generates the ultrasound energy is actually inserted through tiny little incisions under the skin into the fat, and by emulsifying the fat, it allows us to remove the fat more easily. Now, people who make the VASER say that this fat that's obtained in this manner can be used for fat transfer, but that is not my preferred method of harvesting fat for transfer. The other benefits that I do agree with are pertaining to the use of the ultrasound technology to navigate fibrous tissues when people have had previous procedures in the same areas that you're working on. That's one of the most useful benefits of VASER that we don't talk about very much, because it helps to get through scar tissue and such in areas where people have had previous work. That previous surgery could have been a previous liposuction procedure, a previous tummy tuck, could have been something like a gallbladder operation, or even cesarean sections in areas of the lower abdomen will generate scar tissue that makes for challenges with liposuction that are made easier to deal with using this technology. The other advantage of the ultrasound technology is if you actually want to do abdominal etching. Some of the other technologies, you can't work as superficially, meaning as close to the surface of the skin as you can with a VASER. So if you have a six-pack that is available to be unveiled, you can use this technology to unveil an existing six-pack. It is not going to make a six-pack if there's not one there. Okay, so we have to use the technology to remove the fat that's hiding an existing six-pack. VASER is very useful for that purpose. Now, the second technology I want to talk about is a laser. Lasers are numerous. We've had experience with at least 4 or 5 different ones. The most popular one is the so-called smart lipo. That's a brand of laser. It's not necessarily the most user-friendly. It's definitely not the least expensive, and I'm not sure it's any more effective than some of its competitors. But all the lasers are based on light energy generating heat, and the heat causes lipolysis, which means breaking up the fat. And when you break up the fat, once again, it's liquefied and easier to remove. The other benefit of the laser is that same heat stimulates a little bit of collagen formation under the skin, and we believe and we know that the laser used properly with a little bit of modification of technique can be a very useful tool for tightening up loose skin. Again, this is a modality that's helpful when you're trying to spare people the downtime of a tummy tuck. Now, the other advantage of different wavelengths of laser is you do get some so-called hemostasis, meaning you get a reduced amount of blood loss in the procedure as a result of the heat energy. And it essentially is a form of coagulation while you're working. The third technology, I'm going to mention several brand names here because there's slight differences between them, but I'll categorize the different methods of vibrational technology, as I prefer the term infrasonic technology, because once again we're talking about sound waves, but we're working below the level of what we can hear. And at that level we can not only recognize that there's vibration going on, but you can actually feel it. But that vibration is at such a frequency that it confuses the nerve endings and makes things less painful when you use the tickle or the micro air or any of several vibrational technologies. My favorite once upon a time was something called vibrosat. But all of these different technologies vibrate, and I use the term nutational. Sometimes there's a rotation as well as a vibration. And all of these things make for feasibility of less discomfort when you're either administering the anesthesia, and some of these devices actually can be used while harvesting the fat as well. Unlike the first two categories of technology we mentioned, you can use the vibrational technologies as part of the harvesting of fat when you're going to do a fat transfer. I don't like fat transferred after it's been lasered. Obviously, cooked fat's not going to live. Similarly, I think there's enough heat generated by the vaser that despite what the vaser people tell you, you don't get as good a survival of the fat when you harvest it using fat that's been subject to vaser technology. It does make things easier for the surgeon, but it doesn't do much for the patient, and therefore I discourage that technology in that context. Now, there's a new kid on the block. There's really not a new kid on the block. They came out with a concept, fun sculpting, which is the same technology as was around in 2011 when I first started this stuff. Vibrosat was originally made by a company called Mueller in Germany. Would be my favorite toy were it not for its fragility. It's not as durable as some of the things like the tickle lipo. The micro air is a little more popular in hospital settings, but it's not as useful when it comes to harvesting fat or aspirating or infusing the anesthetic. It's a little less flexible when you're switching back and forth between the different steps in the procedure. So all of them have their advantages, all of them have their disadvantages. Consumable supplies and all those kinds of considerations have to be weighed, but that's beyond the scope of this recording. I do like to emphasize that when there's large amounts of fat to be removed, it's almost essential to combine technologies. And the concept of multiple sessions is another issue I'll address in a future recording. And I think we've already addressed that somewhat in the recording, Am I Too Fat for Liposuction? But with multiple technologies and multiple sessions, even people who most folks would label too fat to have a procedure can have a procedure with great results. So in quick summary, there are multiple technologies that are very useful for performing liposuction. I seldom use a single technology in a given case. I almost always use more than one, because different areas of a body will respond to different technologies. And sometimes the best choice is no technology at all. The simple tumescent aspiration and treating fat nicely as you're harvesting it results in better survival if you're using the fat for transfer. So this one man's opinion, the less technology, the better if you're going to be doing a fat transfer. And last but not least, there's new technology on the horizon that will be allowing us to separate out the so-called stromovascular fraction from the fat that we are aspirating. About 6 years ago, we experimented with identifying which segment of the fat that we harvest contained the largest amount of stem cells. Well, that technology has evolved such that we can't talk about stem cells anymore because the FDA wants to call your own fat biological, and they want FDA clearance and all kind of tests to use your own fat that once upon a time we did anyway. So there's a new technology that is FDA cleared where we're talking about stromovascular fraction, which is a way to harvest fat that's replete, if you will, with stem cells and other growth factors that make it useful for regenerative purposes. But I'm going to do another talk on regenerative medicine another day, but that's relevant to the different technologies for liposuction, so I wanted to at least mention it in passing. Now, what about, last but not least, WISELipo? Now, we've all heard the term by now, but WISELipo simply means using whichever technology is best for you. And sometimes that's more than one technology, sometimes it's 2 or 3 technologies. But when you customize a procedure based on which technology is best for the given procedure and the given individual, we call it WISELipo. But thank you for your attention, and I solicit your suggestions for future topics. This one was indeed an example of a response to questions I've received. So if you have questions for future topics, send it to info@wisemedicalcenter.com. And I thank you for listening to the Wise Medical Minute.